Do you find yourself staring at the ceiling at 3 a.m. night after night? You're not alone. If you've been wondering why your sleep has become so fragmented in your golden years, you're about to discover the real reasons behind this frustrating phenomenon. I'm Dr. Sarah from Wisdom of Ages, and today we're diving deep into the mystery of middle-of-the-night awakenings that plague so many seniors. Before we begin, I want you to meet Martha and George. Both are 72 years old. Martha wakes up like clockwork at 3 a.m. and struggles to fall back asleep, often feeling exhausted the next day. George, on the other hand, used to have the same problem, but now sleeps soundly through most nights. What changed for George? That's what we'll reveal today, along with the 7 hidden causes of those 3 a.m. wake-ups and, more importantly, how to fix them. What you'll learn in the next few minutes could dramatically transform your sleep quality and overall well-being. The solution might be simpler than you think, so stay with me as we explore this crucial aspect of senior health. The science of sleep architecture in seniors. Let's start with a fundamental truth. Your sleep architecture naturally changes as you age. Sleep architecture refers to the structure of your sleep cycles throughout the night. When we were younger, we spent more time in deep, restorative sleep. Remember those teenage years when you could sleep through an earthquake? As we age, our sleep becomes lighter and more fragmented. A 2021 study from the National Institute on Aging found that adults over 65 spend 25% less time in deep sleep than middle-aged adults. This isn't just a random change, it's a biological shift in how our brain regulates sleep. Take Richard, 68, who thought something was wrong with him because he couldn't sleep for 8 hours straight anymore. "I used to sleep like a log," he told me. "Now I'm up 2 or 3 times a night." What Richard didn't realize was that this pattern is actually normal for his age. The problem isn't necessarily waking up, it's not being able to fall back asleep. This leads us to our first important insight. Brief awakenings during the night are normal for seniors. It's what happens during and after those awakenings that determines whether you'll enjoy restful sleep or suffer from insomnia. Cause number 1, hormonal changes, the melatonin decline. The first major cause of those 3 a.m. wake-ups is a significant drop in melatonin production. Melatonin is often called the sleep hormone. It regulates our sleep-wake cycle and signals to our body when it's time to sleep. Research published in the Journal of Clinical Endocrinology shows that by age 70, we produce only about half the melatonin we did in our youth. This decline doesn't just make it harder to fall asleep, it makes it harder to stay asleep, especially during the second half of the night. Consider Eleanor, 75, who struggled with 3 a.m. wake-ups for years. "I'd fall asleep fine at 10 p.m., she explained, but come 3 a.m. I was wide awake and my mind would start racing. Eleanor's experience is classic. Lower melatonin levels left her vulnerable to awakening during lighter sleep phases. The fix? While you can't reverse aging, you can support your body's natural melatonin production. Exposure to bright natural light during the day, especially morning sunlight, helps regulate your circadian rhythm. Studies show that seniors who get at least 30 minutes of morning sunlight have stronger melatonin production at night. Additionally, reducing blue light exposure in the evening can make a tremendous difference. Barbara, 78, started wearing amber-tinted glasses 2 hours before bedtime and leaving her phone in another room. "It's not perfect," she admits, "but I'm now waking up closer to 5 a.m. instead of 3 a.m., which feels like a miracle." Cause number 2, bladder issues. The midnight bathroom trips. If there's one complaint I hear more than any other from my senior viewers, it's having to use the bathroom multiple times at night, a condition doctors call nocturia. According to the National Sleep Foundation, over 65% of adults aged 65 plus report regular nighttime bathroom trips. Howard, 77, resignedly told me, "Once I'm up to use the bathroom at 3 a.m., my night is basically over. I just can't get back to sleep." This is an incredibly common experience that disrupts deep sleep and often leads to chronic sleep deprivation. What many don't realize is that nocturia isn't always about bladder problems. Sometimes it's about how your body manages fluid throughout the day. A 2020 Cleveland Clinic study found that the timing of fluid intake is just as important as the amount. The solution starts with being strategic about when you drink. Margaret, 81, made a simple change. She stopped drinking fluids 2 hours before bedtime and made sure to consume most of her daily fluids before 6 p.m. "I was skeptical," she said, "but now I rarely need to get up before 5 a.m. and when I do wake up, I can actually fall back asleep." For those with overactive bladder issues, speaking with your doctor about medication options can be life-changing. But don't overlook natural approaches. Kegel exercises can strengthen pelvic floor muscles, and limiting caffeine and alcohol can significantly reduce nighttime urination. Here's a pro tip that helped dozens of our viewers. Elevate your legs for 30 minutes before bedtime. This helps your body process excess fluid while you're still awake, potentially reducing nighttime bathroom trips. Cause number 3, pain and discomfort. The invisible sleep thief. The third major cause of those 3 a.m. awakenings is pain. Often pain that's subtle enough that you don't even realize it's waking you up. Whether it's arthritis, back discomfort, or minor inflammation, pain sensitivity often increases at night when there are fewer distractions. A study in the Journal of Pain Research found that pain perception can increase by up to 40% during sleep transitions, precisely when you're moving between sleep cycles around 2 to 4 a.m. Walter, 79, was puzzled by his consistent 3 a.m. wake-ups until his doctor suggested it might be his shoulder arthritis. "I didn't feel especially painful during the day," Walter explained, "but apparently, when I rolled onto that shoulder at night, the pain was just enough to wake me." The solution isn't always about eliminating pain entirely. Sometimes it's about minimizing its impact on your sleep. Small changes to your sleep environment can make a world of difference. A quality mattress that supports pressure points can prevent pain from intensifying. Memory foam toppers have helped countless seniors reduce nighttime discomfort. Alice, 74, discovered that taking her prescribed anti-inflammatory medication in the evening rather than morning made her sleep dramatically better. "My doctor said it was fine to time it this way," she shared, "and now I rarely wake up from hip pain." For those preferring natural approaches, gentle stretching before bed can reduce muscle tension. Thomas, 83, started doing 10 minutes of bedtime yoga focused on his trouble spots. "Nothing fancy," he said, "just simple stretches for my lower back and hips." The difference has been remarkable. Remember, chronic pain deserves medical attention. If pain consistently disrupts your sleep, please consult your healthcare provider for a proper evaluation and treatment plan. Cause number 4, sleep apnea. The silent midnight alarm, one of the most serious yet frequently overlooked causes of middle of the night awakenings, is sleep apnea, a condition where breathing repeatedly stops and starts during sleep. What makes sleep apnea particularly dangerous is that many seniors don't even know they have it. According to the American Sleep Apnea Association, sleep apnea affects over 18 million Americans, with risk increasing significantly after age 60. When breathing pauses, your oxygen levels drop, triggering your brain to wake you up, often around that critical 3 a.m. time frame. Gerald, 76, was convinced his insomnia was just part of getting older until his wife noticed his breathing would stop during sleep. Sometimes he'd gasp and suddenly wake up, she reported. After a sleep study, Gerald was diagnosed with moderate sleep apnea. The telltale signs of sleep apnea include loud snoring, gasping for air during sleep, morning headaches, excessive daytime sleepiness, and of course, those middle-of-the-night awakenings. If you live alone, you might not be aware of your snoring patterns, making this condition even harder to identify. The good news is that sleep apnea is highly treatable. CPAP, continuous positive airway pressure. Therapy has transformed countless lives. Gerald initially resisted using a CPAP machine, calling it cumbersome and uncomfortable. But after adjusting to it, he experienced what he calls a sleep renaissance. For the first time in years, I'm sleeping through the night, Gerald told me. My energy during the day is like I'm 20 years younger. For those with mild to moderate sleep apnea, dental appliances that reposition the jaw can be effective alternatives. Weight loss can also significantly improve symptoms for many people. If you suspect sleep apnea might be behind your 3 a.m. wake-ups, talking to your doctor about a sleep study could be one of the most important health decisions you make this year. Cause number 5. Medication. Side effects. The hidden culprit. The 5th major cause of middle-of-the-night awakenings might be sitting right in your medicine cabinet. Many medications commonly prescribed to seniors can disrupt sleep patterns, often without patients making the connection. A review published in the Journal of Clinical Sleep Medicine identified several medication classes that frequently interfere with sleep quality, including certain antidepressants, beta blockers, corticosteroids, and some medications for Parkinson's disease and COPD. Dorothy, 77, struggled with persistent 3 a.m. awakenings for months after starting a new blood pressure medication. I never put 2 and 2 together, she admitted. I thought it was just age catching up with me. When her doctor switched her to a different medication that she could take in the morning instead of evening, her sleep dramatically improved. What makes medication-related sleep disturbances particularly tricky is that they don't always start immediately. Sometimes the effect builds up over weeks or months, making it difficult to connect to a specific medication. The solution isn't to stop taking prescribed medications. That could be dangerous. Instead, have an honest conversation with your healthcare provider about your sleep issues. Often, simple adjustments can make a huge difference. Changing the timing of when you take certain medications, switching to alternative drugs with fewer sleep-disrupting properties, adjusting dosages to minimize side effects. James, 82, discovered that splitting his diuretic dose, taking half in the morning and half at noon instead of one larger dose, significantly reduced his nighttime awakenings while still effectively managing his blood pressure. Here's a practical tip. Keep a medication diary alongside your sleep journal. Note any changes in your sleep patterns when you start, stop, or change any medication. This information will be invaluable when discussing sleep issues with your doctor. Cause number 6, anxiety and rumination. The mental sleep blockers. Have you ever noticed how your mind seems to come alive with worries precisely when you wake up at 3 a.m.? This isn't coincidental. The 6th major cause of middle-of-the-night awakenings is anxiety and rumination. That carousel of thoughts that spins endlessly once you're awake. Neuroscience research explains why this happens. Cortisol, our body's primary stress hormone, naturally begins rising in the early morning hours as part of our wake-up mechanism. In seniors already prone to anxiety, this cortisol increase can trigger worry thoughts that make returning to sleep nearly impossible. Helen, 73, described her experience vividly. "I wake up at 3 a.m. and suddenly remember every unpaid bill, every health concern, every family problem, things I handle perfectly fine during daylight hours." This pattern of rumination creates a frustrating cycle. Anxiety disrupts sleep, and poor sleep increases anxiety. According to a study in the Journal of Psychiatric Research, adults over 65 are particularly vulnerable to this cycle, with nearly 40% reporting anxiety-related sleep disruptions. The solution involves addressing both the nighttime thought patterns and the underlying anxiety. Cognitive behavioral techniques have shown remarkable effectiveness. Robert, 78, learned a simple thought-stopping technique. When negative thoughts arise at night, he mentally says, "Stop," and redirects his focus to a calming visualization. "I imagine myself fishing at my favorite lake," Robert explained. "I deliberately slow my breathing and focus on each detail. The ripples on the water, the feel of the sun, the sound of birds. Before I know it, I'm drifting back to sleep." Practicing relaxation techniques during the day strengthens your ability to use them at night. Many seniors find mindfulness meditation particularly helpful. Just 10 minutes daily has been shown to reduce nighttime anxiety. The free Wisdom of Ages meditation guide in our description can get you started. For persistent anxiety that regularly disrupts your sleep, speaking with a mental health professional can be valuable. Brief therapy focused specifically on sleep-related anxiety has high success rates among older adults. Cause number 7, circadian rhythm shifts. Your body clocks reset. The final major cause of those 3 a.m. awakenings involves fundamental changes to your body's internal clock. As we age, our circadian rhythm, the internal system that regulates sleep and wakefulness, tends to shift earlier. This phenomenon, called advanced sleep phase syndrome, is surprisingly common among seniors. Research from the University of California found that by age 65, many people's natural sleep patterns have shifted 1 to 2 hours earlier than in middle age. This explains why many seniors find themselves falling asleep at 8 p.m. and then wide awake at 3 or 4 a.m. Their body believes it's already morning. Judith, 76, struggled with this exact pattern. "Everyone kept telling me to stay up later, but fighting. My natural tiredness in the evening just left me exhausted and still waking up at 3 a.m. The solution isn't necessarily to force yourself to stay up later. Instead, work with your body's natural rhythms while gently extending your sleep window. Light therapy has proven particularly effective for regulating circadian rhythms in seniors. Charles, 80, started using a light therapy lamp in the early evening, which helped delay his natural melatonin release slightly. "I'm now able to comfortably stay awake until 9:30 p.m. instead of nodding off at 7:30, he reported. "And I'm sleeping until about 5 a.m. instead of 3 a.m. Time-restricted eating can also help regulate your body clock. Research shows that limiting eating to a 10 to 12-hour window can strengthen circadian rhythms. Virginia, 79, stopped eating after 7 p.m. and noticed improvements in both her sleep quality and duration within 2 weeks. Here's a practical step. If you consistently wake at 3 a.m. and can't fall back asleep, try getting up and doing a calm activity in dim light for 30-45 minutes before returning to bed. This works with your natural rhythms rather than fighting them, often resulting in another 1-2 hours of quality sleep before morning. Putting it all together, your personalized sleep solution. Now that we've explored the 7 major causes of those 3 a.m. awakenings, Let's create an actionable plan to reclaim your nights. The key is understanding that you likely don't have just one cause. Most seniors experience a combination of several factors. Start by keeping a sleep journal for 2 weeks. Note when you go to bed, when you wake during the night, any patterns you notice, and how you feel the next day. This information will help you identify your specific sleep disruptors. Next, implement these evidence-based strategies that have helped thousands of our viewers. Optimize your sleep environment. Keep your bedroom cool. 65-60 each day is ideal. Dark and quiet. Consider blackout curtains and white noise machines to minimize disruptions. Create a wind-down routine. Signal to your body that sleep is coming with a consistent 30-minute pre-bed routine. Patricia, 81, reads with amber book lights, then does gentle stretching and deep breathing exercises. It's like my body now knows exactly what's coming next, she says. Be strategic with light exposure. Get bright natural light within 30 minutes of waking up, even on cloudy days. Reduce blue light from screens in the evening by using night mode settings or blue light blocking glasses. Time your consumption carefully. Avoid caffeine after noon. Limit alcohol, which fragments sleep, and stop fluids 2 hours before bedtime. Manage pain proactively. If pain disrupts your sleep, talk to your doctor about taking anti-inflammatory medications in the evening and consider supportive pillows that keep your body properly aligned. Address sleep apnea symptoms. If you experience loud snoring or gasping during sleep, prioritize getting evaluated for sleep apnea. It's one of the most treatable causes of nighttime awakenings. Review your medications. Bring a complete list of your medications to your doctor, specifically to discuss potential sleep impacts. Calm your mind. Practice a relaxation technique during the day so it's easier to use when you wake up anxious at night. Work with your natural rhythm. If you find yourself naturally sleepy earlier in the evening, don't fight it. Adjust your schedule to embrace your body's preferences while using light therapy to fine-tune as needed. Be patient and persistent. Improving sleep takes time. Most of our viewers report significant improvements within 2 to 3 weeks of consistently applying these strategies. Success stories. Real results from our community. Let me share a few inspiring success stories from seniors in our Wisdom of Ages community who conquered their 3 a.m. wake-ups. Lillian, 84, had woken up between 2:30 and 3:30 a.m. every night for over a decade. After implementing our comprehensive approach, focusing particularly on evening light management and anxiety reduction techniques, she now typically sleeps until 5 a.m. Those extra hours of sleep have given me back my days, she says. I'm no longer dragging myself through afternoons in a fog of exhaustion. Edward, 77, discovered his blood pressure medication was a major contributor to his sleep problems. Working with his doctor to adjust the timing of his medication made an immediate difference. We split my dose between morning and noon instead of taking it at night, he explained. Within 3 days, I was sleeping through until 5:30 a.m. for the first time in years. Marianne, 75, addressed multiple factors. I started with the easiest changes, managing fluid intake and creating a better sleep environment. Then I tackled the harder stuff like my evening screen habits and anxiety patterns. After 6 weeks, Marianne increased her average sleep duration from 4.5 to 6.5 hours per night. I feel like I've gained years of quality life back, she reflects. These success stories share a common theme. Improvement came from addressing multiple factors rather than seeking a single magic solution. The comprehensive approach works because sleep is influenced by so many aspects of our daily lives. Special considerations. When to seek medical help. While many sleep issues can be improved with the strategies we've discussed, some situations warrant prompt medical attention. Contact your healthcare provider. If you experience sudden changes in sleep patterns without obvious cause, extreme daytime sleepiness that affects your daily functioning, loud snoring accompanied by gasping or choking sounds, morning headaches that might indicate breathing problems during sleep, persistent insomnia that doesn't improve with self-help strategies, sleep problems accompanied by depression symptoms. Remember that sleep is a vital component of your overall health, just as important as nutrition and exercise. Don't hesitate to advocate for yourself if sleep issues are affecting your quality of life. Conclusion: your path to better sleep starts tonight. We've covered a lot of ground today, exploring the 7 major causes of those frustrating 3 a.m. wake-ups and proven strategies to address each one. The key takeaway is that fragmented sleep isn't simply an inevitable part of aging. It's often the result of specific, addressable factors. Your action plan is simple. Start with 1 or 2 changes that seem most relevant to your situation. Perhaps it's managing your fluid intake differently or adjusting your bedroom environment. Small, consistent changes often yield the most sustainable results. Remember George from the beginning of our video. His transformation came from systematically addressing multiple factors, optimizing his sleep environment, managing his bladder health, adjusting medication timing, and embracing his natural circadian rhythm. Within a month, he went from fragmented sleep with 3 a.m. awakenings to sleeping until 5:30 a.m. most nights. If George could transform his sleep at 72, you can too. The journey to better sleep is rarely a straight line. There will be good nights and challenging ones. But with persistence and the right approaches, you can experience significant improvement. I'd love to hear about your experiences with middle-of-the-night awakenings and which strategies you plan to try first. Comment below with sleep transformation if you're committed to implementing at least 1 change this week. For a detailed sleep improvement checklist based on this video, click the link in the description. And if you found this information helpful, please like this video and subscribe to Wisdom of Ages for more evidence-based health guidance for your best years ahead. Until next time, this is Dr. Sarah wishing you restful nights and energetic days. Remember, quality sleep isn't a luxury. It's essential medicine for your mind and body. Call to action. Before you go, take 10 seconds right now to commit to 1 change you'll make tonight to improve your sleep. Type it in the comments below, and let's support each other on this journey to better rest. If you know someone struggling with those 3 a.m. wake-ups, share this video with them. It might be exactly what they need to hear. And don't forget to download our free 7-day sleep transformation guide using the link in the description. It breaks down these strategies into daily action steps anyone can follow. Sleep well, dream deeply, and I'll see you in our next video. This is Wisdom of Ages, where every age brings new wisdom.